Hello, my name is Dr. Nanekia Sarah Opoko-Champong, a physician specialist at the Greater Accra Regional Hospital, and I work closely with the gastroenterology unit and a neurology fellow in training at the Kolebu Teaching Hospital. Today our focus is on hepatitis B. Annually, on the 28th of July, World Hepatitis Day is celebrated. This is to create awareness in order for us to get rid of this menace. Hepatitis B is a viral infection that affects the liver, which is the second largest organ in the body. This can be very bothersome because the liver does numerous of things such as aids in metabolism, helps in detoxifying, protein synthesis, and many others. With hepatitis B, it tends to affect the liver and destroys the liver cells, causing the liver not to be able to function properly. This year, the theme for World Hepatitis Day is, it is time to take action. Test, treat, and vaccinate. Hepatitis is known to be a silent pandemic. It affects and causes a lot of mortality and morbidity amongst the population. This year, Hope for Little Lives is throwing more light on hepatitis B, its mode of transmission, and it's doing its very best to help combat this menace. The most common way hepatitis B is transmitted from one person to another is actually through mother to child in 90% of cases, especially in our parts of the world. Other forms of transmission can be through infected blood, infected body fluids, and even infected needle pricks. Kids can easily get hepatitis B from their mother during childbirth, which is why it's extremely important for a mother during pregnancy to know hepatitis B status and vaccinate appropriately. When the child is being born, it is very crucial that the baby is vaccinated within 24 hours of birth. That will go a long way to help eliminate hepatitis B from our society. It's been known and been documented by the World Health Organization that hepatitis B affects 70% of the population, most of them found in Africa. This is very worrying, as majority of hepatitis B is transferred or transmissible from mother to child, meaning most of our children below the ages of 5, if not adequately vaccinated, can get hepatitis B. Now, with hepatitis B, you can easily have it in the acute form or the chronic form. If you do get it in adulthood, it's only about 5% of cases which lead on to chronicity, as opposed to a whopping 90% which go on to chronicity and end-stage liver disease if gotten during childhood. One needs to be vaccinated, especially during childbirth. Signs and symptoms you expect to find in hepatitis B could be yellowing of your eyes, you could be a bit warm to touch, we'll call it febrile. You could have a distended abdomen, so there's a lot of fluid accumulation in your abdomen, your feet get swollen, and all that. It's a very devastating disease, and the earlier we hold hands, help each other to get rid of this menace, the better for our populace. Let's all celebrate this year's World Hepatitis Day together. 28th of July, let's all come together. Let's all go out in our numbers. It's time to take action. Let's get tested, let's get treated, let's get vaccinated. Let's encourage one another to know our status. That is the only way. And with our children, who are the future of our country, it is only right that we do them this service. It is only right that we help Hopes for Little Life. And it's only right that we encourage their mothers. They need to vaccinate. They need to get rid of this menace so that we could all live in a happier society. Thank you.